Doctors, leaders and government ministers are being urged to start formal pay talks after a breakthrough on a deal with other NHS staff in England.
Unions representing health workers, including nurses, ambulance staff and paramedics, are recommending their members back a 5% pay rise following months of industrial action. With more detail, here's our health editor, Hugh Pym.
It was an unprecedented series of strikes by NHS staff starting in December. 2 weeks ago, intensive talks with ministers began in England, and now health union leaders have agreed to put a new pay offer to members in a ballot. For this financial year, there'll be a one-off payment of at least £1,655 for the lowest paid workers, with larger amounts for more experienced NHS staff. And there'll be a pay rise of 5% in the next financial year, beginning in April.
This offer that's on the table has been hard won by health workers. We would have liked to have seen this significantly earlier, and we could have avoided all of the disruption over this winter. That said, what we've wanted all along is to give health workers a choice between taking strike action and having a credible offer on the table.
But apart from saying some of the money will come from the existing Department of Health budget, the government's not given much detail on the funding of the offer.
Well, we're being clear that as part of the discussions we had, this would not come from areas of the budget that impact on patients. So those was part of the terms of the discussions that we had. That was the nature of the negotiation, and that was part of the mandate I received from the Prime Minister and from the Chancellor.
A strike by junior doctors in England this week affected all forms of care, including emergencies. Many hospitals cancelled operations and appointments. Yesterday, the Health Secretary wrote to the British Medical Association offering to meet. The doctors' union said it was willing to do so. But he said before he'll only discuss the sort of deal offered to other health unions. The BMA's called for a 35% wage rise to compensate for inflation over 15 years. So while a preliminary meeting looks likely, the possibility of further progress is more uncertain. NHS providers representing trusts in England said there must be urgent movement on talks with the junior doctors, and both sides needed to redouble their efforts. Hugh Pym, BBC News.
Let's talk to our political correspondent, Helen Catt, now. Morning to you, Helen. So we know now these proposals are going to a vote. We wait and see what happens. The junior doctors' situation is ongoing.
It is, yes. So this development with the health unions, it is significant. It shows that it is possible for unions and the government to reach an agreement in these disputes, which of course have been going on for so many months now. And of course, reaching agreement in one part of the NHS, again, though, we should say it's not a done deal. The members do have to vote on it first. That does increase the calls on the government, on the junior doctors, to settle that dispute too. Now, you heard in Hugh Pym's piece there that the BMA, the British Medical Association, which represents junior doctors, has said it will have a meeting with the government. We're expecting that to happen fairly shortly, in the sort of near future. But having an initial meeting is not the same as sitting down for formal pay talks, and that might be a harder position to get to.
Helen, thank you very much.
The Metropolitan Police